What if I told you that the single most effective thing you could do for your practice's organic growth this year does not require a budget, a marketing agency, or even a film crew? Just requires a phone, a topic, and 3 minutes a week. I'm talking about a health tip video series, not a one off video and not a promotional clip, but a consistent weekly series where you show up every single week and answer one question your patients are already asking. Practices that do this well don't just grow their online audience, they create something far more valuable, a group of patients and future patients who actually look forward to hearing from them. Today, I'm going to show you exactly how to build one. Most practice owners that I've talked to have tried video content at some point. They recorded something, posted it, got a handful of views, mostly from their own staff, and then they quietly gave up. And the reason it didn't work isn't what they usually think it is. It wasn't camera quality, it wasn't the editing, it wasn't that their topic was wrong. It was that they posted once, maybe twice, and then they stopped. Here's the fundamental truth about building an audience with video content. A single video is a whisper, a series is a conversation. When patients know a video coming every Tuesday and that you show up every week, same format, same face, same value, they start to anticipate it. They share it, they subscribe, they start to feel like they know you before they ever book an appointment. That's the compounding power of a consistent series. And it is something no one off video could actually replicate. I knew of an internal medicine physician that I worked with 12 years in practice, an active patient panel, genuinely passionate about preventative care. The kind of doctor that spends extra time explaining things in the exam room because he actually cares whether his patients understand. He had tried posting on social media before, a few general health posts, a couple of videos about flu season. Nothing stuck. His Facebook page had 180 followers after 3 years of sporadic posting. And then he tried just one thing differently, picking one day, a Wednesday, and committed to posting one 3 minute health tip every Wednesday morning, no exceptions, same format, same intro, same thumbnail style every week. The topics came directly from his own exam room. The questions his patients asked most often: blood pressure myths, sleep and metabolism, what certain lab numbers actually mean. Real questions, plain language, his face, his voice, his warmth. Within 6 months, his Facebook grew from only 180 to over 2,400. His YouTube channel had 1,100 subscribers. And new patients were calling his office specifically mentioning the videos. They were saying, I've been watching you for months. I want you to be my doctor. He hadn't added a marketing team. He didn't increase his ad spend by even $1. He just showed up every Wednesday with one useful tip, and his community responded. Now, let me show you the difference between what most practices do and what actually works. The typical practice video talks at patients. It's informational, but it's impersonal. The topic is generic. There is no consistent schedule. It opens with the practice name instead of a hook, and it feels like a lecture rather than a conversation. No wonder it only gets 3 views. The series approach is completely different. It answers the specific questions your patients are already asking in your exam room. It's posted on the same day every week, so patients know when to expect it. It's personal. One provider, one topic, just 3 minutes. And it opens with a hook that earns the next 3 minutes before the viewer even has a chance to scroll past. And here's the result that matters most. Patients share it because it can help somebody else that they know. A series builds an audience, while a one-off video just gets forgotten. The content itself matters less than the consistency. Show up every week and your audience grows. Skip weeks and it stalls. Now let's talk about what goes inside each of the videos. Every episode in your series should follow the same 5-part formula. And when you internalize this, you can record a video in under 20 minutes from ideation to done. Part number 1 is the hook. Just the first 15 seconds. Open with a question or a surprising fact your patient is already wondering about. For instance, did you know that most people with high blood pressure have no symptoms at all? That's a hook. It earns the next 3 minutes in the first 10 seconds. Part 2, talking about the problem, the next 15 to 45 seconds. Name the pain, the symptom, or the misconception clearly. Make the viewer feel seen and understood before you try to teach them anything. This is what will keep them watching. Part number 3 is the actual tip. 45 seconds, maybe to 2 minutes. Deliver one clear, specific, actionable tip. Not 3, not 5, just 1. Explain simply and completely. The discipline of 1 tip per video is what makes the format work. It's what patients will remember and share. Part number 4 is the proof. 2 to 2.5 minutes in. A brief clinical stat, a patient outcome story, or a simple analogy that makes the tip feel real and worth trusting. This is what separates your video from a generic health blog post, your clinical credibility applied to something specific. Part 5, the next step, 2.5 to 3 minutes, 1 clear call to action. Book an appointment, subscribe for next week's tip, or share this with someone who needs it. Every video ends with some type of an invitation. Not a sales pitch, an invitation. 1 topic, 1 tip, 1 call to action, every week without fail. That's the formula. 12 videos in, you'll have built more trust with your community than most practices have built in 3 years of sporadic social posting. Here's what I want you to take away from all this. You already have everything you need to build a health tip video series. You have the knowledge, you answer these questions every single day, you have the credibility, you have the patients whose lives you've changed. The only thing between you and a series that builds your practice organically, month after month, video after video, is a decision to show up consistently. Pick a day, to commit to the format, and to trust that the audience will come when you do. Your patients aren't tuning in for production value. They're tuning in for you. And the practices that understand that, the ones that show up every week, plain and honest with one useful thing to say, those are the practices that patients follow, trust, and eventually choose. Now, if you would like some help building up your health tip series, picking your topics, setting up posting schedule, creating thumbnails and branding, well, that's the kind of thing that I do. And if you'd like to talk about it, we can take 20 or 30 minutes, no pressure, no obligation, to just have a consultation about how you can make it happen and work for you in your practice. My name is Kurt Landreth. Connect with me by phone, by email, or set up an appointment in the schedule provided. And I look forward to talking with you soon.